What is research? Research is how we try to learn answers to questions about medicines. Health studies testing new medicines are called clinical trials or studies, and they test new medicines on people to learn if they are safe and if they work well. If you are thinking of taking part in a clinical study or trial, you'll be called a participant. There are a number of important things that you will need to know. You have rights and responsibilities. One of your rights is that the study must be explained well to you by the study doctor so you understand it. This will be explained before you start the trial and before you agree to take part in it. Another right is that your personal information from the study will be kept confidential, and only the doctors and researchers will see your health information. They are not allowed to tell anyone else anything about the trial. It's the study doctor's responsibility to make sure your life, health, privacy, and dignity are protected. You have to be completely honest with your study doctor, or your health could be at risk and you may get hurt. When the trial ends, you'll be told of how to take care of your illness. You may be able to stay on the new medication which you received during the trial. If not, you'll be able to get other care or treatment. Taking part in a clinical study means you may get the chance to get treated with new medicines that aren't in chemists yet. The information received from the study may help treat people with your illness in a better way. Your illness may also improve, but if the trial medication is not effective or you receive a placebo, which is a sugar pill, you may not benefit from taking the study medicine, but you will still learn how to cope with your illness. You will be told why the study is being done, what tests will be done, like blood or urine tests, and what your responsibilities are. You'll also be told of any risks or difficulties you may face, like getting a bruise after giving blood, as well as the benefits and what you might gain. You'll also be told how many months the study will last and how many times you'll be seen by the doctor. On each visit to the study doctor, you may have tests taken and be examined by the doctor. The doctor will give you their contact details so you can contact them in an emergency. You may ask as many questions about the clinical study as you want to at any time. Taking part in the study is your choice. No one can force you and you do not have to agree. Only once you understand the clinical trial process completely will you be asked to sign the patient information and consent form. This means you understand and agree to everything you've been told. You'll be given a copy once you have signed it. If there is anything you still do not understand, please ask the study doctor. Don't sign anything until you've discussed it with your doctor, family, or the person giving you health advice. If your doctor believes the treatment you're getting now is working and you shouldn't change, he or she will tell you. Not all clinical studies make you stop all your medication. The study doctor will tell you what pills or medication you're allowed to keep taking. Clinical studies test new medications, so we may not yet know all the side effects. If you have side effects that make you feel sick, tell the doctor. You won't be allowed to enter the study if you are pregnant, breastfeeding, or trying to have a baby. You may be asked to use a contraceptive. If you become pregnant during the study or trial, tell the doctor immediately. Being part of a clinical study or trial is free and won't cost you anything. All medicines, treatments and tests will be paid for, as well as some travel costs. Ask your study doctor what is paid for by the trial before you start. You could also be paid for any injuries you may receive from being in the trial. To be part of a clinical study, you must have the illness being tested. So if the trial is for asthma, you'll need to have asthma. Or if it is for diabetes, you will have to have diabetes. You may be asked not to drink alcohol or take street drugs. It's important you are told everything about what you can do and what you can't do. It's important you work together with the study doctor and follow all their instructions. Don't take any other medicine, even from a pharmacy or herbal medicine, without telling the study doctor. If you don't follow instructions or take the study medication properly, it may be harmful to your body and you may be asked to leave the study. If you get sick from the new medicine while on the study, you will get treatment at no cost, but you must have followed the study doctor's instructions. Illnesses like colds and flu aren't covered by the clinical study. You can ask the study doctor to explain what will happen or how to get help if you become sick. Even if you have signed the consent form, you may still stop being part of the study at any time. All you have to do is tell the study doctor that you don't want to continue in the trial. If you leave the study, you'll be told how and where to go for further treatment of your illness. Ask the study doctor if there will be any changes to your illness or health if you leave the trial. If you understand the trial and sign the consent form, but you don't follow the instructions, the study or trial doctor has the right to ask you to leave. Remember also that the doctor's responsibility is to take good care of your health. If they feel that being on the trial isn't good for you or can harm you, they may advise you to stop the trial. They will also put all the reasons down in writing for you. Doctors doing clinical studies try to find the best treatments for illnesses and learn as much as they can about them so they can help other sick people. You shouldn't sign up for more than one clinical trial at a time. Always ask as many questions as you need to so you totally understand the study and what you need to do. Remember, this is your health and your body. By being part of a clinical trial, you will have also helped other people suffering from this illness. Thank you.